If you knew a lot about me, you'd judge me a
No.
lot. So
I don't love you.
yeah,
Are you kidding me?
yeah.
Oh, dog. What are we talking about?
You should talk louder in the video.
I hear my voice just fine. What are we talking about? All right, we'll just start it off. Ready?
No, we're just
Three.
supposed to be like goofy in the beginning.
No.
So let's just. So, why does Healthcare.gov take so long?
It's ran by the government.
There
I
you
mean,
go.
hello. Anybody got their tax check back yet?
A lot of you guys out there get frustrated by the fact that everything on Healthcare.gov takes forever.
Yep.
And it does. And trust me, we are just as frustrated as you guys are.
Yeah, we hate it.
Because it takes forever. We know it takes forever. We try to warn our clients, but sometimes they don't get to us in time. A good example of that is say that you lost your job, right? And you've got 2 months. The law is you got 2 months to sign up for a new plan before you become not eligible for a Healthcare.gov plan.
60 days.
60 days. Okay. So some people have COBRA coverage, or their insurance from their company is going to cover them to the end of the month or to the next month or whatever. And a lot of people will call us in right at the end of that coverage period where they have like 1 day left until they have no insurance. And then they call and say, oh, hey, guess what? I need health insurance right now for tomorrow.
Yeah.
And
Don't do
sure,
that.
if you're healthy, we can get you on plans outside of Healthcare.gov.
Yep.
On short-term medical plans. But if you're not on a short-term medical plan and you have to go on Healthcare.gov, then you've got a serious problem because it's red tape. Healthcare.gov takes forever to do anything.
You got to submit paperwork. We put all the information in.
Yeah.
And then you have to have what's called a special enrollment period, which is that 60-day window. I have a client right now that she lost her coverage end of February. And on February, I'll give you an example. On February 15th, somewhere around there, we submitted her plan, even though it wasn't ending until February, right? On the 20th, they said we need to submit documents, so we submitted the documents. Till this day, her coverage still hasn't started, and it's March 8th.
Yeah.
Now, it'll retroactive back to March 1st, but as of right now...
But that can take a long time.
Yeah, as of right now, it's still not there.
Say someone needs a CHIP or a children's health insurance plan, or they need Medicaid.
Yep.
And we don't know that sometimes until the application's finished. And
Correct.
so we go through the entire application, and at the end of the application, then it says, hey, guess what? You may be eligible for Medicaid. So what it's going to do now is kick you over to Medicaid. You need to wait for Medicaid to get you an answer.
Yep.
And then you need to come back to Healthcare.gov and let them know what happened.
Yes.
And then at that point, you can get the insurance. But then sometimes you got to go through appeals. You got to go through other processes. You got to submit claims to get your insurance. And then once you do, then they can backdate it, to when you first were applying for it. But it's a whole process. It's difficult, and sometimes it just take a while.
Yeah.
So just contact us as soon as you can,
Yeah.
and we can help walk you through it.
Yeah, it's always good to be too early versus too
Oh
late.
yeah, like I told the family the other day, she's going to be having a baby, and I said, call me at least a month before you have that baby so we can start the process of the paperwork so we can get you on different insurance afterwards.
Yeah, so it's just a couple clicks and done.
Yeah, because we want to get the process started as soon as we can because we know that there's a lot of hang-ups that sometimes happens.
Yeah, it takes time. And especially during, open enrollment. I know it's March, but I feel like it shows up like next month.
Yeah.
Even though it's still November. And we'll get a lot of folks that this year the website crashed like 3 or 4 times. And it's just, again, it's anything that's, and I don't want to harp on the government. I love America. Don't get me wrong. But anything that's typically government funded and ran and whatever, you guys have called healthcare.gov. I mean, they're not giving you the attention that we do. Nothing at all. I mean, you can't even understand what they're talking about half the time because they don't care to explain it. There's a call center. They don't care. So the moral of the story is, the healthcare.gov, the reason it takes so long is it's just a huge entity, big process, and it's a government. And B, people, clients and customers come right at the deadline or a little bit too late. So, if you know you're losing coverage at the end of March, call us now.
Yeah.
Call us now. Let's get the process started to where at the end of March, I can click the button and it's already good to go. And come April 1st, you got coverage.
Yep.
And it's not like my client that's waiting right now. I mean, if something happens to her, it's going to retroact back and she's going to be covered. You know,
Yeah.
but at the same time, she wants to go to, let's say, a gynecologist visit right now. She's paying that money out of pocket.
Mm-hmm.
You know, she's going to get it back because the plan we got, she has a $20 off as a copay. But as of right now, she's paying that $200, $300 out of pocket.
Mm-hmm.
And then when her plan finally does get approved, which we've been told it's approved, so now it's just waiting to be submitted, you know, then it comes back. But yeah.
There's a lot of waiting with Healthcare.gov. But just if you're prepared for that, then it's not a big deal. But you just got to be prepared for it. That's why we suggest you call this as soon as possible. Also, if you wait to call us until like March 1st to get coverage, it's not going to start until April 1st.
Correct.
Because they always start the first day of the following month.
Mm-hmm.
So if you call us you need to call us February 15th to get coverage on March 1st.
Correct.
Okay, so like we said, just the earliest possible. So as soon as you know that you need health coverage, you call us and we'll get the process started.